and welcome to another episode of Spotlight on Health. I'm your host, Dr. Stephen Eschenauer, the health officer at the Kanawha-Charleston Health Department. Today, we're turning the tables a little bit. Today, I'm actually going to be interviewing two reporters, and we're actually going to have more of a didactic discussion more than an interview. But today, we have Emily Rice and Katie Coyne joining us. So, Katie, Emily, thank you for joining us here on the show. And so let's start with you, Katie. Tell us a little bit about yourself and how you ended up here in Charleston, West Virginia.
So I am originally from California, grew up there, and went to WVU. I've lived in West Virginia for about 11 or 12 years now, and I absolutely love it. So I took a job at the Charleston Gazette-Mail when I finished college, and I worked there covering southern West Virginia, specifically the coal fields, for a little over 2 years. That was one of the best experiences of my life. Still have some of the best sources and the best reporting that I'm most proud of happened down there. And literally about 3 months before the pandemic, I transitioned into the full-time public health reporter in January of 2020. Wrote a few stories about Kanawha-Charleston Health Department at the time, and then March hit and the pandemic started, and it was nonstop pandemic for about 3 years, with a lot of addiction and drug reporting in the middle, which is something I'm also very passionate about and ties back to the coal fields.
Definitely a very busy time in public health to be a reporter.
Yes. Yeah.
And this is quite a bit different than Northern California.
I'm from
really
Southern
fall in love
California.
with the state that much that you decided to stay.
I did, yeah. My dad's still down in San Diego, but it's affordable to live here, I'll say that, on a reporter's salary. But I really do love the state and just being able to meet people here. I did everything I could my first 2 years at WVU to try and transfer back to California. And then once I started investing my own time into the state, traveling a little bit more, getting more invested in journalism, honestly, which I think is a great way to get to know different places and different people. It's the most at home I've ever felt, and I love this place. So when I annoy you about it, it's because I care.
I understand that. I haven't been in the military for 30 years. I was gone a lot, and it was always nice to come back home.
Yeah.
Yep. To the Mountain State. So, Emily?
Sure.
Please
my
tell
name's Emily Rice. I'm the Appalachia Health News reporter for West Virginia Public Broadcasting. I come from journalism. My dad's in journalism, so even though he didn't necessarily want me to follow in his footsteps, I did. I went towards the photography side, so I was a photojournalist. I went to Marshall University, graduated in 2016, and pretty much headed west. Worked in Colorado as a photojournalist and education reporter for a couple of years. Made my way back east and landed in Virginia, where I worked for the Bluefield Daily Telegraph for 3 years. That's down in Mercer County near McDowell, Southern Coalfields again. And I was focused on features there, but when the pandemic broke out, there were really not enough reporters to cover it, and I was one of the ones that was still there, so I took up public health. And I've really just grown an attachment to it. So after that, I wanted to move even closer to home. I was still in Virginia, and moved back home to the Charleston area in 2021, and took a job with a magazine for a while, worked in advertising for a while, and finally found my way to West Virginia Public Broadcasting in December of 2022, and have been there reporting on health ever since.
Excellent, excellent. So you both have had a good bit of southern West Virginia coalfield experience.
Yeah.
Yeah, that is very interesting because it also probably gave you a lot of exposure to a lot of the problems that we've faced in the coalfields, in particular the opioid crisis, and both of you have written and done a number of really good stories on opiates. So, Katie, tell us a little bit about your kind of introduction to how bad the opioid problem was here in West Virginia.
Yeah, so I was working at the Charleston Gazette-Mail at the time. I'm currently with West Virginia Watch, but I was there for a while. And, I'd been to Charleston once when I started. I had never stepped foot in southern West Virginia. And Eric Ayer famously a Pulitzer Prize winner for his opioid reporting. He was on staff with us at the time, and I had the incredible opportunity of being able to work with him while he was sort of doing some research and stuff for his book. So we would travel together, he would introduce me to people, and I would write a daily story while he was collecting things for Death in Mudlick, which was eventually published a few years later. I think, my introduction to it was really trying to focus on the people at the center of it. I got here and I was reporting on this in 2018. So this was after we had seen a lot of the peaks, a lot of the worst of the drugs coming in. These were people dealing with the aftermath of that and a changing drug crisis, a transition to more of an unregulated black market drug use than, prescription opioids. Overprescribing was still obviously happening, but it wasn't necessarily what was driving a lot of the overdoses that we were seeing. And, starting with that, I've gotten to tell stories of people who have had their records expunged and have turned around and become complete community leaders after, spending years in the criminal justice system because of actions that they've taken when they were in active addiction. And I think for me, the stories that I like to tell and focus on most when it comes to opioid use are the stories of people who are navigating it still, but also have found a way to come at peace with themselves. And a lot of what that looks like is, becoming a peer recovery specialist, learning how to give back to your community. We talk a lot in recovery fields about how to become a part of a community again that might not see you as a member, no matter if there were legal activities, whatever it was. Sometimes when you're in active addiction, people will do things, and that doesn't reflect well into the community. So trying to figure out, what are the success stories of people who have been able to reinvest in their community and be accepted back in, and what do we do to break down the barriers for accepting people back in? Stigma is really, really bad, especially, I think, in impoverished areas, which the coal fields are some of the most impoverished in the state. There's a lot of competition. There's a lot of sort of feeling like the rest of the state is looking down at you, which people tell me all the time, and also having to navigate day-to-day life without a lot of the resources that we have here in Charleston sometimes. It takes a lot longer to get to work. It takes a lot longer to get to a hospital, to get into treatment if that's what you're looking for. And those are all things that I think over time and person to person really compound to make navigating addiction, much less recovery, much more difficult than, I'll ever be able to understand. I've never been in active addiction. I've never, experienced that. So learning how to listen to people when they're talking to you about it and centering their experiences over what you think their experiences should be. That was a really big, I was 22 years old doing this for the first time, so that was a really big thing that I owe to the people of the coal fields who were incredibly patient with me and willing to hand-hold me a little bit to be like, hey, let's look at what's really happening here, instead of what you often see in national outlets and or headlines that are not the most complimentary of what are actually really good efforts sometimes.
Yeah. So Emily, tell me a little bit about your experience, especially you were down in the Bluefield area,
Sure.
Which spans the West Virginia and Virginia.
Absolutely. So I grew up here in Charleston, in the suburbs, and I think it's a very different upbringing to grow up in suburbia, West Virginia, versus the coal fields, versus I'm sure the Eastern Panhandle and Wheeling as well. It's all different. And we are such a diverse state to be such a small state. But I think it taught me so much about what people are really facing down there. And like you were talking about, people in recovery serving as these leaders in communities. And it's obviously inspiring, but it's something that the people that are in active addiction can actually see a peer recovery specialist and see someone that they can relate to, see someone that has been where they are, whereas, no offense, but a physician coming in or something, they're going to say, you have no idea what I'm dealing with. Let's see, what else was in there? So our overdose rates, what I've been focusing on recently, nationally, overdose rates have fallen slightly, and in West Virginia, they've risen just slightly by 1.43 or 34%. And that is, data from 2022. But I think, and this may be hopeful, this may be optimistic of me, but I think we're seeing a lot of the actions that were put into place, a lot of the programs that were put into place kind of come to fruition, and hopefully see those changes really come through and do good for people that are in active addiction.
Yeah, it is an extremely challenging issue from a public health perspective all across West Virginia, not just in the southern coalfields, though that area has definitely been hit the hardest compared to the other parts of the state as far as numbers. And then even tracking a lot of times what the opioid death numbers are, trying to get accurate data can be a challenge as well from a public health perspective.
Yeah, I've been working on a spreadsheet for the last 3 work days. That's all of our opioid data, or our overdose data for the last few years. And that's a story that, I think all of us tend to do annually-ish of, here's how much we've increased, decreased fatal overdoses, here's where they're focused. And I think the most interesting story right now, interesting feels a little cavalier, but what we should be focusing on maybe is how practices are changing, what drugs are involved in overdoses. We're actually, from what I was looking at last week, we're seeing not significant at all, but like a decline in the number of overdoses that are involving opioids. We're seeing a lot more of the xylazine, a lot more of the fentanyl, and that, there was, and other drugs have dropped completely. I think heroin in 2023 to date, which was our preliminary numbers, we had 8 heroin overdoses in the state. That's down from 200 and something, 5 years ago. That's a pretty significant, I don't think we've seen that degree of change in a single drug use in the state that we've been able to track since we saw an increase, and now we're seeing that change. But the question that raises is, if people aren't using heroin anymore, what are they using?
What I've been seeing as an ER physician is it's combination.
Yeah,
combination.
Polypharma, yeah.
Absolutely. To see someone use combinations of methamphetamine, heroin, fentanyl, xylazine, any combination of those is not really uncommon. Uni-drug overdoses or just a single drug seems to be the rarity today, because many of these are blends of something.
Right.
But yeah, fentanyl and xylazine are a big concern because, one, they're synthetics, and 2, they're very potent.
Well, Narcan, we don't have the right tools in our hands to stop it anymore. We got ahead of one thing, and now we're going to have to figure out how to get ahead of the others.
Yes, the Narcan does work on fentanyl, but not on xylazine.
Yeah.
It works completely differently. So tell me a little bit about your writings that you've done for these. Emily, what stories have you done specifically on the opiates?
Well, I've been focused, like I mentioned, the recent statistics, but I've also been focused on the West Virginia First Foundation. That's our legislature created a foundation to divvy out our opioid funds from our national settlements. And I've been following what they're doing a lot. And as well, Katie's been doing some incredible reporting, some data reporting that I don't have time to dig into as much as she does.
Well, that's why this is a great segue.
Because
because you both have been looking at it from different angles. It's kind of looking at a statue, one from the left and one from the right.
Yeah.
So you both have some good viewpoints on this. But it is a big an interest area because it is a fair amount of money. And what have you found so far in your research?
So I think Katie has the most recent numbers, if you could rattle those off, if you have those.
For
the West Virginia First Foundation.
Like how much money they're getting? I'm not going to get that right now.
Well, what I have is they stand to gain about $1 billion over the next 10 to 15 years.
Yeah, I want to say.
That's a good, I've heard that number somewhere around that. Not that we know an exact number right now, but
and there's
approximately.
Money
I think we're at like 6.8 million in the bank.
Yeah,
right now.
and there's money in a bank account that's accruing interest. And it's really, I had a conversation with the executive director of the board last week, and he was describing to me how this is such a unique organization in the way that they are founded and the way that they elected their board members actually from a county level. So there's different regions in the way that the state is split up, and each of those regions elected someone to represent them. And a lot of the times, the executive director was actually a member of the board, and he was replaced by someone who runs a clinic in their area. So hopefully, and what the plan is that these people have on-the-ground experience with the crisis and will be able to put those dollars toward harm reduction, and which is also another big topic in the state that gets political a little bit when you try to talk about it. But
oh yes, many opinions.
Yeah. So with harm reduction, that would be, clean needle exchange, syringe exchange, and those programs have been able to operate and be moderately successful in Cabell County, but they're not able to where we are in Kanawha County for a myriad of reasons.
And I think a big thing that we're seeing, so the First Foundation exists, there's separate pots of money. So every year there's a certain amount that's made available through these opioid settlements. About 3/4 of it goes to the First Foundation, and another quarter of it is split between the counties and municipalities. So everyone that's getting money is going to continue getting money. It's just going to be a smaller pot every year for the next 10-ish years until it's gone. What we're seeing now is the counties and localities are giving out their funds. We're seeing small county or small city councils, county commissions vote to give, $200,000 to a rehab service or something like that. We're also seeing a lot of places put their money directly into the jail bill, or at least opening up discussions to do so. And that's a big thing that I think we're going to see unfold. If anyone that's done personal budgeting, is it worth having a big one-time thing that you pay off now, or do you save your money and try to stop yourself from accruing that debt in the future, right? So what we're seeing with the jail bills is really, if you have, let's make up a number, $100,000, and you pay that off on your jail bill this year, that's all the money you have. You're not going to be able to invest in any other programming, any other, rehabilitation, connection to services that maybe could, over the next 5 years, lead to 20 fewer people going to jail from your town. That would decrease your jail bill. If we were able to do that times 10, that's 500 people that would not be going to jail, and
kind of
so
like the
on.
ounce of prevention is worth a pound of cure.
Right.
If we
Yes.
can invest in preventing those unnecessary incarcerations or people being jailed,
We save
we're
money.
likely to save a lot more money in the long term.
Yeah. And a lot of these, looking at the First Foundation, I have a lot of concerns. I think everyone in the state right now has a lot of concerns. And I'm not saying that I've seen anything I don't think there's anything sketchy at all going on there right now. But, it's really easy, I think, to fumble a good thing, and we won't know until it's too late. And for that, we've never done this before. This is a really weird organization. It's a private nonprofit that was created through state code. And as one staff attorney at the legislature said, they are, quote, a creature of code now. They've adopted these transparency policies that I really, truly do believe that they want to follow, that they want to be transparent with us. I have no inkling and no reason to believe that they don't. But at the same time, they've opted not to actually adopt the Open Meetings Act. They've opted not to make themselves actually open to FOIA requests. That is something that, were it an actual arm of the state, if it was codified and it was a commission or a task force, we wouldn't even have to ask twice about. It would just be there because they're created through the state. So
Yeah, I could definitely see from a reporting perspective that's very concerning, because talking about around $1 billion of public funds dispersed out over a decade, and it's not FOIAble and it's not necessarily open meetings. Have you found any of the meetings to be open?
they're all open so far, and I think my
Okay,
biggest
good.
concern, the people that are there right now, the odds of them being there forever, we don't see that. What are the odds of every board member that's being there that is really committed to this transparency? And I truly believe that they are. Are they going to be there in 5 years when I'm asking the same questions? And and whoever's there then, are they going to share the same values as the people who founded this, who trusted themselves to be transparent, but don't have control about who their predecessors are? These are staggered board terms. We're going to have a new board member every 1 to 3 years. I have a lot of concern about that, and I think looking back at how we handled tobacco settlements in the state in the 90s, that was pretty it wasn't the same thing. We didn't have this private nonprofit, but a lot of money went to places that we can't track, and I don't think there are a lot of people in the state who would agree that that tobacco cessation money and the tobacco settlement money went to places that directly supported people who were hurt by tobacco use. And that's, I think, the biggest concern for people who are working in addiction recovery right now is, are we going to see the money? How do we make sure that we're putting money into what we know works? And I don't think it's wrong to not have the answer to that right now. I hope that we can have conversations about how we find that answer instead of just committing ourselves to one way of doing things.
I see.
Absolutely.
Any other comments on that, Emily?
I think you summed it up perfectly.
I have a lot of thoughts on the first foundation. That's all I've been looking at for the last few months.
Well, you brought up the tobacco cessation funding, and some of that funding was supposed to go toward, reducing rates of smoking in West Virginia. Our smoking rates, that's one of my topics to talk about, are through the roof. And so we don't want to see, in 10, 15 years, we don't want to see, back in the 2020s when we were talking about the West Virginia First Foundation, we had all these plans and still be where we are in 10, 20 years. So I think that's what we're mostly worried about.
That's a good point to look at. This is what we did before, this was what worked, and this is what clearly did not work because smoking rates are actually up. And what do you think that is from your work, your research?
Not enough funding being put toward tobacco cessation and funding for programs and government programs that will help people actually, first of all, there's prevention, and I've heard from so many advocates lately, not even lately, in the past 3 years, that they've got kids vaping in the bathrooms at school. It's down to middle schoolers, it's down to 6th graders, that they're finding and confiscating these, vaping devices from. So I think a lot of it has to do with prevention. A lot of it has to do with not even letting it get started. And that comes down to a policy level and how much money are we willing to put toward cessation and prevention efforts, and these resources that the state has that is able to help people either quit or not start to begin with. Right now we have an adult smoking rate in West Virginia at 21%. High school tobacco rate is at 27%, which means almost a third of high school students are using tobacco. But the report from the American Lung Association outlines a call to include increasing funding for tobacco prevention and quit smoking programs, and to also eliminate punitive youth possession. So to not put a kid with a vape into juvie over it, to actually intervene where the issue is here, because the place, and I cannot remember where this statistic comes from, but the place where these kids are acquiring these the most is from their family. So how can we step in before they see mom and dad vaping and let them know what those outcomes are actually going to be for them? So how do we, level out fear-mongering campaigns with tobacco with vape campaigns for this generation? How can we mitigate those results that we're having in West Virginia?
Even just offering therapy, smoking cessation therapies for kids. That wasn't something I think that we thought a lot about in the 90s, but with vaping and the rates that we're seeing today, Dr. Young used to talk about this a lot when Kanawha passed its Clean Indoor Air Act. A big gap, not a lot, but we did discuss it a few times, a big gap that they saw was, we don't have smoking cessation programs for kids. We can send you to a therapy session at HealthRight. We can send you, the state has some great ones, I think, but what do you do with a 12-year-old? Their brains are different than ours. If I'm trying to quit smoking, I need different interventions than a child who is in middle school does. Our day-to-days are different. Our stressors and our triggers for why we're smoking is different. And what that does to brain chemistry. I mean, if your answer at 12 years old to stress is to hit a vape, that's going to affect you for a really long time.
Oh, absolutely.
And I don't think we figured that out anywhere, much less here. Yeah.
Mm-hmm. Yeah, it is a huge challenge as we look ahead, and surprising of how much adoption of nicotine, whether it's smoking, chewing, or vaping, has occurred among kids. So it's very concerning.
I think my biggest win from the legislative session personally was they, after 10 years, the legislature finally got on board and passed a law to make it to stop smoking in cars with kids. So there's like a $25 secondary fine if you're caught doing it, but like it took 10 years to get that. It's where do we go from there?
Oh, I understand. And then many on the other side, well, that's freedom. I should be free to do whatever I want. And in the name of freedom, do you eliminate seatbelt requirements, helmet requirements?
Yeah.
Eliminate speed limits, eliminate smoking laws.
And they've tried.
Yes. Yeah, there are definitely those that lean on the far right of freedom to the point that it affects others, in particular those children. And unfortunately, I was one of those kids that grew up in the back of a car with two parents that smoked.
Me too.
All the time, and I hated it as a child. Well, we're getting down into the end of the show, so I want to thank you both first for the time that you take out of your schedule to come on the show here, and for the work that you're doing in public health. It's, I think, vitally important that we get good reporting, and you two ladies have done a great job on covering a number of subjects, to include opiates, and of course, nicotine, tobacco cessation, and smoking in public spaces, which is still seen to a certain degree, but not like it used to be, that's for sure. But what I would really like to do is invite you both to be back on the show in the future as well, and we'll talk about a new round of subjects, because the depth of all that you've worked on is pretty incredible, and I'd like to hit on a few more of those subjects on a future show.
Yeah.
So,
absolutely.
Yeah, happy to.
Emily, any final words before we get off the show?
No, thank you so much for having me. And even though health can seem like a pretty, down, depressing topic, sometimes there are some bright spots. We've got some good stuff coming for West Virginia.
Mm-hmm.
Yep.
And Katie?
And, echoing all of that, I think that we have a really great group of reporters in the state right now who are looking at a lot of different issues through a lens of public health. I've been reporting here for about 7 or 8 years, and I haven't seen this kind of focus before. So I'm really excited about what we're all doing. And we're all supporting each other doing it. I think that's really special. So,
oh, absolutely.
What we have going on right now is really good. And, talk to reporters. If you see something, say something, I guess. That's what I've got to say. But thank you for having us. It's great to catch up and talk with you.
Oh, yes. This has been very informational.
Yeah.
And thank you to our guests today. And thank you for listening in to Spotlight on Health. I'm your host, Dr. Stephen Eschnauer with the Kanawha-Charleston Health Department. Wish you a great day. Thank you very much.